about this and the impact, I am joined by Scott Ratzan. Scott is the editor-in-chief of the Journal of Health Communication, International Perspectives, with years of working on global health literacy. Scott, thanks very much for joining us. We certainly appreciate it.
Well, thanks for having me, Sean.
You know, it may seem like they're coming to the game a little bit late, but Novavax comes at a very important time. Can you explain why this fourth vaccine could be so important right now?
Well, it's excellent that science has been successful and continues to approve vaccines that can help us get out of this COVID pandemic. Now, you are right that Novavax has been approved in many other countries, but yet the United States is one step closer with now this FDA advisory group. Then there'll be an FDA regulatory group that will approve it. And then there'll be an advisory committee of immunization practices at CDC that will recommend its use broadly. Right now, there are about 27 million Americans who have not got any vaccine. This new vaccine might be the new push that helps them say it's time, because this Novavax vaccine is just like the shingles vaccine and the hepatitis vaccines. It's a whole protein vaccine, which is different than the other ones. It may give that extra bit of comfort to people who have been on the fence or have been waiting.
You know, from hearing you talk, it's clear that this approval is not going to be overnight, but it looks like it is moving certainly in the right direction. You talked about the target audience, the 27 million who haven't received any kind of vaccine. But who else is within that target audience?
Well, you know, vaccines are one of the most important, shall we say, scientific advances that we've had in the last century. We've been able to get rid of some vaccine-preventable diseases from the planet, such as smallpox, and nearly eradicated polio. We need all the vaccines in our arsenal to make a difference here. So this is an actually added one, in addition to the mRNA ones that are already on the market. Then there's the AstraZeneca, Oxford, variety of other ones from different countries that are around the world. But all vaccines are not equal. And adding this to our arsenal, if we get new variants, this may be one that is able to protect us more than some of the others that are already been given to people around the world.
You know, I love the way you talk about how these vaccines are really huge advances, but it still is another sign that this pandemic is far from over. Upcoming hearings for the U.S. vaccine for children under 5 years of age. What do you expect to hear then? And will this help in an effort to return to normalcy?
Well, really, Sean, thank you for raising this for a show on global business, because nothing is more important than for us to protect our children. And our children being protected also will protect all of us, because we won't have the vaccine circulating, which has the potential to mutate and bring it home, as well as with schools and so forth. I expect the children under 5 vaccine to also get the recommendation from the FDA and then the Advisory Committee of Immunization Practices. And then hopefully we'll be able to get these vaccines in arms of children. However, what we have seen, even with the vaccines that are approved right now in the United States and many other countries from age 5 upwards, is that we don't have the same coverage that we need. We only have about less than half of the children vaccinated from age 5 to 18. So a lot of work needs to be done on that group. And as soon as this 5-year-old, an under 5-year-old is approved, we need to do everything we can. We need to have campaigns. We need to have politicians and business leaders also helping support this, because it's important for us to get back to some level of normalcy, as well as, you know, protecting our most precious asset, our children.
You know, Scott, summer's here. I've traveled some for work, some for fun. In the United States, in many ways, when we walk through airports, go to stores, restaurants, we don't see a lot of masks. Is it way too early to act like things are fine?
Well, certainly some cities and universities have already thought that it's too early. Alameda County in Northern California, UCLA, a couple of others in California have been that way. Other big cities have said that it is time to have masks. I think that we probably have been a little bit too quick, that we made it seem like rather than it went from black to white, there's a lot of shades of gray. There's a lot of places where it would make sense to wear masks. And I think we should put that in our arsenal, just as if we're have a smoke alarm at home to protect us from fire. We should have a mask to protect us when we're going out, and to protect others if we are, in fact, potentially sick ourselves.
Scott, thanks so much. I got my second booster last week. It's always great to hear from you. Thanks so much. Scott Ratzan, the editor-in-chief of the Journal of Health Communication, International Perspectives. Again, thanks.